From common medical problems to a rare incurable condition, here are 9 reasons why some people can't sleep. Before we begin, be sure to subscribe to They Will Kill You. Hit the like button and request any topics you'd like to learn about in the comments section below. Number 9. Obstructive sleep apnea. It may be the most common sleep-related disorder on our list, but that doesn't make it any less dangerous. People with obstructive sleep apnea are known to snore, and the disorder is characterized by pauses in breathing during sleep. That's because the throat muscles become relaxed, thus blocking the airway. The periods of decreased breathing are called apneas, which literally translates as without breath, and they can last from 20 to 40 seconds. The brain then kicks into gear, causing the sleeper to wake up and reopen the airway. This sleep-wake process can occur several times every night. Hence, sufferers are left without restful sleep and become tired during the day. Many people experience obstructive sleep apnea at some point during their lives, and it usually lasts a short period of time. A small degree of it is actually within the boundaries of normal sleep. However, chronic and severe forms of this disorder are known to wreak havoc on overall health. The lack of oxygen and the sleep deprivation increases the risk of high blood pressure, cardiovascular disease, diabetes, stroke, or clinical depression. Number 8. Exploding head syndrome. Judging by its name, exploding head syndrome, or EHS, may sound like the scariest disorder on this list. However, that really isn't the case. It's characterized by the person experiencing a very loud, unreal noise, such as an explosion or cymbals hitting each other while they're falling asleep or waking up. The cause for exploding head syndrome is unknown, but some theories include stress and anxiety, PTSD, or minor seizures in the temporal lobe. There are no treatments for it, but pain is typically absent and is not considered to be a life-threatening condition. Number 7. Narcolepsy. People that suffer from narcolepsy are overwhelmingly tired during waking hours and may experience sudden sleep attacks. They may fall asleep, often without warning, multiple times during the day. They may also experience cataplexy, a sudden loss of muscle tone, which usually follows a strong emotional response, such as laughter. People with narcolepsy tend to sleep as many hours as those without it, but the quality of sleep is much worse. The cause for the disorder is unknown, but in up to 10% of cases, the onset is genetic. Its manifestation involves the loss of neurons, which release orexin, a peptide that regulates wakefulness. There's no known cure for this condition, but certain medications and lifestyle changes can help manage it. Number 6. Night terrors. Night terrors, unlike nightmares, occur during non-REM sleep. The distinction didn't exist up until rapid eye movement was discovered. Those who suffer from night terrors may suddenly stand upright with their eyes open and a look of fear on their face. Sleepwalking is often associated with night terrors, and people may also scream or thrash their limbs. They appear to be confused, inconsolable, and unresponsive to attempts of communicating with them. They may in some cases seem wide awake, but they aren't, and trying to wake them isn't recommended. A person going through night terrors isn't actually in danger and doesn't require treatment. The disorder typically occurs in children aged 3 to 12 and generally fades away with age. Number 5. Sleep paralysis. During REM sleep, brain activity increases significantly and we begin to dream. To keep us from acting on those dreams, the voluntary muscles in the body enter a state of paralysis. Sometimes, people wake up during REM sleep while they're still paralyzed, a phenomenon known as sleep paralysis. They're aware of their surroundings and want to move or speak, but they simply can't. Sleep paralysis is usually accompanied by intense feelings of panic and fear, as well as shortness of breath. What's even more terrifying is that people may also experience visual or auditory hallucinations of an evil presence in the room. They may feel the evil presence sitting on their chest, crushing the wind from their lungs. This sensation has earned sleep paralysis a place in folklore around the world. Depending on the culture, it's known as Old Hag in Newfoundland, ghosts pressing down on you. In China and in Mexico, it's known as the dead climb on top of you. Sleep paralysis has been proposed as an explanation for many reported paranormal experiences, such as demonic possession or alien abduction. Sleep paralysis is fairly common. It shouldn't cause concern, and those who experience it regain the use of their body rather quickly. However, going back to sleep after such a frightening experience might take a while. Only about 5% of people have regular episodes, and some treatment options include sleep hygiene, antidepressants, and cognitive behavioral therapy. Number 4. Nightmare disorder. Nightmares are not uncommon, and most people experience them from time to time. Yet for those suffering from nightmare disorder, the occurrence is much more frequent and it can be debilitating. The sleeper may scream and yell out things during the nightmare. The threatening, frightening dreams may cause people to wake up and vividly remember their experience. They may have an elevated heart rate and go through symptoms of anxiety. It's often difficult for sufferers to go back to sleep as they fear experiencing another nightmare. The disorder can affect the quality of life for people who suffer from it. The lack of sleep and the anxiety means they often have trouble going through everyday tasks. Nightmare disorder can be a consequence of a mental disorder, or it may be caused by extreme pressure or irritation. Talking with a psychiatrist is recommended, as well as yoga, meditation, and exercise. Number 3. Sexsomnia. Sexsomnia is a type of parasomnia, an abnormal activity that an individual performs during sleep. Unlike other forms of parasomnia, like sleepwalking or night terrors, the discussion of sexsomnia is marked by hesitance and lack of research. The disorder may occur due to stress, sleep deprivation, consumption of drugs and alcohol, as well as a side effect of certain sedatives like Ambien. It's characterized by the sleeper engaging in masturbation, fondling, intercourse with climax, and, in its most severe forms, sexual assault and rape. Even though a person suffering from sexsomnia may be sexually aggressive, they typically won't remember what they did during waking hours. There have been several situations in which a sexsomnia diagnosis has been used in court for alleged rape and sexual assault cases. Swedish man Michael Halvorson, for example, was acquitted of rape based on a sexsomnia defense. His unusual sleep behaviors had reportedly begun at a young age. The report of sexual assault was filed by his girlfriend at the time. When the police arrived at the scene, Halvorson was still asleep in the alleged victim's bed. During his appeal, a previous girlfriend testified to his abnormal behavior during sleep, and the man was subsequently acquitted based on the fact that he wasn't conscious during the assault. Number 2. REM sleep behavior disorder. REM sleep behavior disorder, or RBD, is a condition mainly characterized by the loss of muscle paralysis during REM sleep. The underlying causes aren't well understood, but according to some theories, RBD is most likely a symptom of neurodegenerative diseases such as Parkinson's or dementia with Lewy bodies. Because of such conditions, brainstem circuits may become damaged and no longer capable of sending the proper signals during sleep. The manifestation of RBD usually involves the person who is sleeping acting out their dreams. Since the dreamer's muscles are no longer paralyzed, they can exhibit complex behaviors that include screaming, laughing, crying, arms flailing, choking, punching, kicking, and even jumping out of bed. Since violence is more likely to be recalled in dreams, people with RBD will often perform violent or aggressive actions. They're likely to injure themselves as well as their bed partners. It's recommended that until the condition is managed, the bedroom be made safe by removing sharp objects and possibly sleeping alone. Treatments with clonazepam and melatonin are among the most frequently used. Number 1. Fatal familial insomnia. Fatal familial insomnia, or FFI, is a very rare disorder that is typically inherited genetically and which ends in death. It's caused by the mutation of a major prion protein in the thalamus, the part of the brain which regulates sleep. Those who suffer from it completely lose their ability to sleep as the disease progresses and begin to deteriorate both mentally and physically. All known cases end in death, usually about 18 months after the onset of symptoms. There is no known cure for FFI, and things like sleeping pills have been found to only hasten its progression and worsen its symptoms. One of the more recent reports regarding the disease involved siblings Haley and Lachlan Webb from Queensland, Australia. They described FFI as a family curse, and although they hadn't developed the symptoms, they were aware that the disease could strike them at any time. Haley and Lachlan first became aware of FFI in their teens when their grandmother was diagnosed with it. She died of the disease at 69, as did their mother at 61, aunt at 42, and uncle when he was just 20. FFI usually has 4 stages. It starts with increasing insomnia, paranoia, panic attacks, and phobias, which worsen by the 2nd stage, when hallucinations start to develop. The 3rd stage, which lasts for about 3 months, is characterized by the complete inability to sleep, followed by rapid weight loss. In the 4th and final stage, sufferers usually develop dementia and become unresponsive, after which death follows. The Webb siblings, both in their early 30s, hoped they wouldn't be among the younger ones in their family and that a remedy will be found before it would be too late. Thanks for watching. Can you think of other medical reasons why some people struggle with sleep? Let us know in the comments section below.